Now, out of those same 100 people with these procedures, one or two fails, which is a huge improvement, especially when it comes to the economic, the mental cost of undergoing a revision surgery.
Hello and warm welcome to MedSynapse podcast series, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and as we know, ACL injuries are one of the most common and devastating injuries in sports medicine. To shed some light on the topic, we have amazing guest with us, Dr. Manit Arora. He is the consultant shoulder and knee surgeon in Fortis Hospital. He has published over 100 papers in international journals in the field of orthopedics and sport medicine. He runs a clinical research group and is fellowship director for arthroscopy and sport medicine fellowship. Welcome, Dr. Mani, to the podcast.
Hi, how are you? Thank you for having me.
We are excited to have you here.
Great, and I'm happy to be a part of your program and hopefully share some insights into ACLs.
Thank you so much. So we'll start with our first question. Let's talk about the buzzword stem cell, particularly mesenchymal stem cells. They have been hailed as the next big thing in ACL repair, with some studies showing they might help with tissue regeneration. But on the flip side, other research suggests the clinical benefits are minimal. So what's your take on it?
So stem cells are really important, and I think we're now truly sort of understanding their role and how important they are for regeneration of tissues. And ACL is, one of those things where it's the most commonly performed orthopedic surgery globally. So last year there was more than 200,000 ACL surgeries done in the US. In India, it's probably somewhere close to that amount. Now, unfortunately, despite the high volume of these surgeries and despite how long we've been doing them for, we still suffer from failures. And some of those failures are mechanical failures or technique failures. Some are due to other reasons, but one of the important failures that we want to counteract with stem cells is what's known as biological failure. So we want to give the graft the best chance possible to heal and grow. And that's where stem cells come in. So with these stem cells and their newer application to ACL surgery, we're hoping that we can cut down the biological failures that used to happen with ACLs, which should overall reduce the failure rate, and two, help the graft become stronger, grow better, remodel how we want it to remodel. And in that way, it's good for the patient because they end up having a more sort of natural ACL.
Okay, perfect. So let's move on to the more practical approach and talk about the treatment for every patient, right? So who are the real winners when it comes to regenerative therapies? Are there specific type of ACL injuries or certain patient profiles that actually see meaningful benefits, or are we just applying these treatment too broadly and hoping for the best result?
So I think we have to be very narrow with our indications as to who we want to use them for at present, because there's not a lot of evidence for them at present. And so if you give them to everybody, it's unlikely it's going to, we want to give it to those groups of patients who really need it, who lack the biology of innate healing. And that group, one of those groups is the sort of older category of patients. They're the ones who are, relatively older. They're 40 plus. Their internal biology is less. So in those patients, we definitely want to stimulate biological healing. And the second group of patients are those that have chronic injuries. So we know acute tears, they tend to, do quite well. It's those chronic, patients that come in with 5 to 6 year old injuries, who still, somehow have coped with instability. They're the group that, that second group that we want to target with these regenerative therapies.
Okay, that was perfectly addressed. And so let's transition to a subject that has been making waves lately and sparking a lot of discussion, that is anterolateral ligaments. So we know that anterolateral ligaments plays a key role in the rotational stability of the knees. So should we be addressing the ligaments more in ACL reconstructions?
I think in 2025, if you have a pivoting injury of the knee, before we used to think you just get an ACL tear. Now we know that you get an ACL tear and an ALL tear. So ALL is the anterior lateral ligament, and it has an important role. In a cadaver, if we just cut the ALL, it leads to more anterior translation and it leads to pivoting of the knee. So say you leave everything in place and you just remove the ALL, they end up having more pivoting and more anterior translation, which is exactly what happens with ACL. So they're a synergistic ligament, they work together. And yes, the amount of ALL reconstructions, or what's otherwise known as LET or LEAP procedures, they have drastically increased. Now, since they've increased, the patient populations in which we're doing them, the failure rate has decreased by 3 times. So before, say, if the failure rate out of 100 people, say 7 to 8 failed, now out of those same 100 people with these procedures, 1 or 2 fails, which is a huge improvement, especially when it comes to the economic, the mental cost of undergoing a revision surgery. So right now we're offering it to people that have explosive pivots or high pivoting knees. I think that's the ones where really this ALRI or anterior lateral rotatory instability is very important. And those in which they've had an ACL surgery and it's failed, and we want to make that second ACL surgery not fail.
Thank you for addressing the percentage-wise comparison. So let's talk about the big concern. What happens if an ACL injury is neglected or if reconstruction fails? So we know that ACL injuries can lead to osteoarthritis down the line. So what can be done in osteoarthritis development?
Yeah, unfortunately, in my practice, I get a lot of patients who have had ACL injuries before, have been told that you're not a player, you're not an athlete, you don't need an ACL. Now, they typically come to us about 7 to 8 years after their injury with medial-sided knee pain or pain on the inner aspect of the knee. When we do their MRIs, when we do their x-rays, we often find that the medial compartment of the knee has undergone arthritis. Now, in these patients, we're stuck because neither can we do an ACL because they've already got arthritis, and neither do we have any definitive solutions to address the arthritis as well as the ACL. The only sort of thing we have in our arsenal right now is something known as a high tibial osteotomy. And in the last sort of 3-4 years, I've started doing many more of these high tibial osteotomies, which basically involves cutting the bone, realigning it so we can offload the pressure on the medial compartment of the knee. So that's a drastic surgery. And as much as possible, we try to avoid them. But unfortunately, if you do not address your ACL properly, whether it be surgically or non-surgically, at the time of your index injury, you do end up, eventually leading into this sort of picture, which is what we want to avoid in our patients.
Oh, thank you so much for the answer. As you have perfectly explained from stem cells to osteoarthritis, now we'll wrap up the podcast. And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussion, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy. Take care.